Hello darlings, I hope you're all well. Very sorry about my inconsistency. I'm getting a camera soon, hopefully. So when that happens, I will be more productive. Today's YouTube video is going to be about cocaine. It's often widely glamorized and people with BPD are very likely to become cocaine addicts. I'm not that knowledgeable on cocaine, but I have a lot of research and my makeup is inspired by cocaine. I'm so annoying. I'm literally so annoying. Let's start. I have my notes on my phone, so if I'm looking down, I apologise. Cocaine is one of the most psychologically addictive drugs because of how it stimulates and increases your level of the feel-good neurotransmitter dopamine in the brain. Cocaine can cause so many psychological problems. It can cause a plethora of mental illnesses. It can cause schizophrenia and psychosis, so it's like, why do we take it then? Easier way of coping with your emotions and stuff, but let's take a deep dive into why it's bad, because it's not glamorous. Some of the psychological symptoms of cocaine addiction: poor decision-making capabilities, restlessness, irritability, psychosis, brief state of euphoria, sudden overabundance of confidence, mood swings, agitation, irritability and depression, elevated body temperature, high blood pressure, dilated pupils, runny nose, persistent nosebleeds, loss of appetite, burst of energy, reduced need for sleep, breathing problems, hypertension, heart attack, insomnia, liver damage, kidney damage, stroke, cognitive impairment. That's not even covering it. Cocaine is usually used repeatedly. That can lead to irritability, depression, restlessness, panic attacks, paranoia, and full-blown psychosis. When it comes to coke, I knew it increased your heart rate and it could cause heart attacks. I knew it can burn your nose bridge if you're like doing it up your nose. Not only nosebleeds and having just one big nostril, you can also lose your sense of smell for life. And even if you think it's not an addiction and you're just doing it recreationally, it can really affect you down the line. And I've heard stories about people who didn't think they had a problem until 20 years later they had a heart attack or a stroke. Your body kind of develops a tolerance to it and you need more and more. With increasing doses or higher frequencies, it can cause adverse psychological and physical effects. There's a lot of animal research, and I don't condone testing on animals, but study's interesting. So a study suggested that binging on cocaine during adolescence enhances the sensitivity to the rewarding effects of cocaine and MDMA. Thus, binging of cocaine in adolescence may further increase your vulnerability to the continued use of the drug. It can cause hair loss. Yay! Hair loss. That's fun. We love a receding hairline and we love going bald. Recreational use of cocaine has always been linked to hair loss. I just didn't know that. I had no idea. There was a study with some rats, of course, poor babies, injected cocaine under the skin of these poor rats, and within 48 hours under the patch that they injected, they had no living cell tissues of like hair, so their hair fell out. Also, the study concluded that cocaine injected or inhaled is toxic enough to reduce cell division in hair follicles and frequently cause telogen effluent, and I have no idea what that means, but I think that means hair loss. When you snort cocaine, you might get nosebleeds, lose your sense of smell, your voice becomes like hoarse, you can't swallow, like you have problems swallowing, which to me sounds like constant tonsillitis. People who inject it are more vulnerable to HIV and AIDS. Smoking crack cocaine, you could have asthma or a lung problem. But honestly, crack and cocaine are the exact same thing. The only difference is like racism and the war on drugs. My favourite crime YouTuber, Bailey Sarian, did a video from her Dark History series about cocaine versus crack. When you hear like, oh, they're a crackhead, it is a classist term because crack was more in the poor areas of America, whereas cocaine is seen as such high class. Honestly, cocaine is never pure, even if like someone really wealthy is saying like, oh, it's the good stuff. Cocaine is almost always cut with something. What's on the streets today? Here's the menu. Adulterants used in cocaine. Benzocaine is usually used for local anesthetics in creams, ointments and suntan lotions. Boric acid, which is used as an antiseptic and it's in like cosmetic products, and it's used to fireproof fabric. It's added because it kind of looks like cocaine crystals. Caffeine is added as a mild stimulant. Creatine which is a naturally occurring compound found in the body. That's just because it's easily accessible and cheap. Dilithium, I said that wrong, basically used in treatment for heart conditions like high blood pressure. I literally can't pronounce this word. There's also a chemical in it used to make plastic wrap like cling film, but that's used in tranquilizer. They also add something that is a local anesthetic for surgery, mannitol, which is a naturally occurring compound used in medication for kidneys. Paracetamol is obviously a painkiller. This thing is another painkiller. It's no longer used in the UK because of its cancer-causing properties. Procaine, which is a local anesthetic used in creams, ointments and suntan lotions. Sugars, also tetramethyl hydrochloride. I don't know, so basically something is in there to treat worms in animals. So what you're snorting right there is what they treat animals who have a parasitic infection of worms, and it's also used in treatment for certain cancers. I've also heard it could be cut with laxatives. You know when you take coke and you have a numbing effect and you can't feel your mouth? That is because of the dental anesthetics that they put in. No matter how you take it, cocaine affects many other organs in the body. Reduces the flow in the gastrointestinal tract, which can lead to tears and ulcerations. Cocaine is well recognised as being toxic for your heart and the cardiovascular system, so it can cause you chest pains that feel like a heart attack, and it sends many cocaine users into the emergency room. Cocaine is also linked with increased risk of stroke, also neurological problems, as well as inflammation of the heart muscle, and basically it's more likely to rupture. And honestly, the symptoms of cocaine addiction do remind me of the symptoms of anorexia. This might be a bit graphic, but I just want to talk about like what can really happen if maybe you take too much. There's been reports of like a hemorrhage in the brain, and your brain can bleed if you take too much coke. It's really gross, but your brain bleeds, hemorrhages and like internal bleeding, and balloon-like bulges of the wall in your blood vessels. So after your blood vessels burst, you can develop movement disorders such as Parkinson's disease, which can occur over years of cocaine use. Loads of studies found that it can cause a range of cognitive dysfunction. You have a lack of attention span, you might be more impulsive, your decision making is impaired, and you have memory loss issues. For performing different like motor tasks, your decision making involving punishment and rewards is basically like really up. I didn't know that oral consumption can cause bowel decay, tooth decay, gum decay. Prolonged use of cocaine can obviously lead to financial problems. The best therapy for coke addiction is CBT, cognitive behavioural therapy. Obviously, mood changes is a big thing, and mood swings and stuff is a massive part of mental illness. So it can lead to personality changes as well, not just mood changes. It can make you more irritable, it can cause depression, it can give you anxiety, paranoia, it can totally worsen your mental health, especially if you're already mentally ill. And it can cause mania and delusional thinking. When you take too much coke, or you just regularly take coke, it's associated with a lack of ability to experience pleasure without it. And I think the worst after severe depression is suicidal ideation and feeling like you can't experience pleasure anymore. My laptop's starting to buzz, so I really hope you can't hear it. There's a lot of social problems and social change, like relationship issues and stuff, and it can cause aggression and abusive behaviour in extreme circumstances. I can't speak. It can make you manipulative and secretive, and I know from experience that anorexia can make you all these things. It can make you keep secrets, it can damage relationships. Now that I'm thinking about it, coke and anorexia give me the same vibes. I'm not judging anyone who takes cocaine, I promise, but I do think talking about different drugs and the effect it has on your brain and your body is very important. Your health is kind of important, so it causes low dopamine. It's just not healthy for your brain or your heart. Also cause eye problems. So can heroin and weed. I'm sure like loads of drugs can cause eye problems. I also want to talk about what it does to your skin. I don't know the definition, but this is what it looks like. That might be an extreme or chronic use of cocaine. I promise the quality of my videos is going to get better soon, and I will make more frequent videos. Thank you so much for watching and being patient with me. It means so much to me. Stay safe, and if you think you have a problem, please visit your GP. See you soon.